we have our model here, and we are going to start talking about, I think, the barbed, or what we call cog threads. I think Viola makes a couple of beautiful threads, and you definitely need to start playing around with all of them. I think there's 20 gauge, 19 gauge, and 18 gauge. They're typically about 100 millimeters in length as far as the cannula size. Each one of those gauges has a different robustness to the thread and how much more lifting power that they do have. There is a little bit more step up as you do use a larger size gauge thread. And so definitely looking at your patients, you want to evaluate how much lifting you're going to need on a patient, but you also want to evaluate how thin the patient's skin is. The thinner the skin is, the more smaller gauge that you may want to be using. The thicker that they have the skin, you could probably use a thicker one to get more robust lifting in that sense. I think the biggest and hardest thing when you first get started with threads is, where do I start? Typically, you're going to start in an area that is, I call it vectoring. And so what you really do need to do, and kind of when you're doing like your fillers, is you really want to kind of play with the patient's tissue and kind of see where she's going to get the most lifting out of the tissue. Because you want to choose a point where you're not creating all these holes on the patient's face just to throw different threads in different angles. You want to choose a point where you can put in 2, 3, 4 threads out of one port site, so that you can get the maximal lifting effect. Okay, so for most patients, for nasolabial folds through the marionette area, we're going to be focusing more on this lateral portion of it. And you can kind of see by pulling on the patient's face how much more lifting in certain areas. I like this angle because I feel as though it definitely pulls her up here and in here. Pulling her up in here can maybe pull up in here. So before we get started, let's map out our vectors. So for this patient, I'm going to start off back in this area, and we're going to draw a vector along the area that I want the thread. Actually, I'm going to start up a little bit higher, and then I'm going to throw another one right here. I like this vector as well, so I'm going to throw one here. And I'm going to throw one here, and this will pick up that jowl. For her, I think one down here is going to be important, and I may throw another one across this way to pull her. So you can see we already have 6 threads. Most of my patients that I like to do are probably going to be in that 6 to 8, 6 to 10 per side. Whenever I'm doing a jowl, I also will throw 2 in the submental area. So you want to find the SCM, the sternocleidomastoid. That's going to be your fixation point, and we're going to start in this area. And then pretty much, if you have them, lift your jawline up, follow the jawline, the mandibular line, and about a centimeter down from that, you're going to okay. So that is my typical patient. She is much older, much more saggier. Your younger patients, you may get away with 1 or 2 here, like 2 up in here, maybe a little in here, maybe a little in here. And you can focus that, but since we're doing a more global rejuvenation, we'll talk about, we're going to do all 8 threads on this patient. We're going to numb her up. Numbing is one of those things that is very individualistic on patients. I think that my biggest thing is always to numb the entry points. You want to bleb that area. You probably use a lido with epi, or lido with epi and lido combination with a little bicarb. Put a bleb in each of these areas of probably a 0.05 to 0.1. Let it sit for 5-10 minutes so that you do see that there is blanching. It'll minimize bruising in that area and allow the patient to really be comfortable, because a lot of us get into a big rush of things. We inject them with lidocaine and we're off doing it. It still has not completely kicked in. So really give it about a good 5-10 minutes to kick into play. Different theories with regards to actually numbing the actual tract itself. When I first got started, I was taught actually to just bleb superficially or a little bit deeper across this area and you're literally just placing blebs along the track lines. You can definitely do that. The other way that I've been taught is once you place a dollop in the port site of lidocaine, you can actually take like a 22 gauge, 2-inch, 2 3/4 inch, and actually follow the whole track and place no more than 0.05 or 0.05 to maybe 0.1 in each track. You don't want to place a lot of lidocaine in there. You're going to hydrodissect the tissue out. And when you dissect out the tissue too much, when you place your threads, the barbs or those cogs have nothing to hold on to. And you're going to have to sit there and really mold and mold and mold the tissue so that the barbs actually do hook onto the tissue properly. Otherwise, you won't get a good hold on it and you could potentially have migration. So you can definitely do that. The other third way, a little bit more cavalier than I like, is some practitioners will actually just bleb into the areas of the port site and that's it. They'll tell the patient it kind of will feel like pressure and potentially a little bit pain. I always find that in this nasolabial area, the facial nerve endings do end somewhere around here, so patients do end up feeling a little bit more sensitive even after numbing in through this area of the face. So I always warn patients that as I'm getting closer to this area, a lot more fibrous tissue, as I'm pushing through a ligament or something, you may feel a little bit more tenderness. So I always warn patients about this. So as far as numbing, really depends on what you're looking doing for your patient, how much more comfortability. You can definitely do like a Pronox or something like that. You can have them on Xanax, Valium, whatever you want to make the patient comfortable. For the most part, it's a very, very comfortable procedure. Just a little bit of lidocaine is enough. Typically, when I'm injecting a patient and I'm doing this, I'm probably using no more than 5 cc's on each side of the face. Next segment, we're going to be talking about superficial threads and mesh threads. So the superficial threads are actually a couple of different types. There's actually ones that we call mono or smooth, that's just one straight thread. There are ones that are called twists, which is actually taking that mono thread and actually wrapping it around the needle even more so you get actually more thread placed in at one time, so you get more collagen stimulation. There's double twist thread, which is 2 threads or not barb, but braided together and actually twisted around it so you can get it. So there's a lot of this, think of it as just smooth threads in many different combinations. The more threads you kind of have in there, the thought pattern is going to stimulate more collagen, more volume. There's also ones that we call mesh threads that actually are made into looking like a mesh in a circular form that are placed to give her volume. And so we're going to use some of that today to actually help her place a little bit of smooth threads maybe into this area. We're going to actually place a little bit of actual mesh threads into this area to give her some volume into this area. And then we're going to actually use some PLLA threads to actually soften up a little bit of this under eye area. We're going to actually give her a little bit of mild volume. PLLA is a different type of thread. It's like Sculptra, it's polylactic acid. It's going to be a lot more collagen stimulation. Remember, anything that we're talking about with these smooth threads, it's going to take at least a month to really start to stimulate out your collagen into the area. So this is where the smooth threads are very helpful, but they're not going to give you the immediate effect that you see from your lifting threads. So you can see we just did her lifting threads. We're going to talk about adding the smooth threads on top of the patient. Okay. As well, we're going to talk about a little bit of the cog threads and the barb threads to actually do a little bit of brow lifting. So there's 2 ways of doing brow lifting. If you find that there's a lot of tissue laxity into this area, you can do the brows. Typically, you can come up and do it like this. You can do it like this. And to raise the brow up. She doesn't have much laxity in this area that a brow lift is going to help her out in any which way. Where most of your patients are going to garner the best results is actually to do more lateral lifting of their eyebrows to kind of raise this portion of it. So this is where we would come in and actually see what vector is going to be the best at lifting up this area, and we're going to see it's through this area and through this area that we're going to get the best lifting. And so we're going to place a little bit of barbs to actually give her a nice lift through her tissue and through this area. So we've done some barbs and lifting into this area. We're probably going to place a little mesh threads to create more volume in her cheek into this area. A little bit of PLLA threads underneath the eyes to actually start to stimulate some collagen. I like PLLA underneath the eyes, or PDO, whichever one you want to use, as more of that superficial play. Fillers are still important as a structural component. Do it just up to about 70–80%, and then you can come back in with some threads and place it on top to actually stimulate better quality of skin. It'll help with tightness, it'll help with firmness, it'll help with collagen stimulation, it'll help with some volumization. So this is where threads is going to be a very powerful usage in your toolbox. Threads down in this marionette area is going to be great. We could potentially even do a little bit of threads into her lips as well to actually give her a little bit of mild volume in her lips. And so definitely numb up for that. Superficial threads, topical numbing is good enough. You don't need to do more than that. When you're coming to the barbed and cog threads, I would definitely recommend you use injectable lidocaines in those areas.